Hello. VBAC stands for vaginal birth after caesarean. The term is used when someone delivers a baby vaginally after previously having a caesarean birth. When we use the term vaginal birth, we mean any delivery via the vagina, including those requiring forceps or ventouse. Many people have a strong desire to deliver vaginally after having a caesarean, as it can have both physical and psychological benefits for parent and baby. Understandably, some people are apprehensive, especially after having had a difficult labour in the past. Most people who have had a caesarean can safely go on to have a vaginal birth. There are a number of benefits of having a VBAC. These include less tummy pain, as you haven't needed a cut in your tummy, a lower chance of developing a blood clot in your legs, avoiding the risk of surgical complications such as damage to your bladder or bowel, a lower chance of your baby needing to go to the neonatal unit, a greater chance of an uncomplicated normal vaginal delivery in the future, and a quicker recovery. You can often go home within 24 hours and can move around more easily at home. There are two main risks associated with a VBAC. The first is having to convert to an emergency caesarean delivery whilst you are in labour. Anyone planning a vaginal birth may have to have an emergency caesarean. However, the chance of this happening is slightly higher when you have had a previous caesarean. The second risk relates to your scar. 5 in 1,000 women having a VBAC will experience a weakening or opening of their previous caesarean scar. This is called a rupture. A ruptured scar can have serious consequences, including bleeding. 3 out of every 10,000 women who have had a significant bleed will need to have their womb removed to stop the bleeding. This is called a hysterectomy. In most pregnancies, you will go into labour naturally, between 37 and 42 weeks. If you're planning a VBAC but you haven't gone into labour by 41 weeks, there are a number of different options. These include continuing to wait for labour, inducing labour artificially, which does increase the risk of your scar rupturing, or deciding to have a planned caesarean birth. For many people, a VBAC is a safe choice, which carries very little risk. It's always important to speak to your midwife or obstetrician early in your pregnancy so that they can discuss your individual circumstances.